I'd like to start this webinar by acknowledging that I'm on land of Indigenous people, the Ngunnawal people, Aboriginal people of this area, and I pay my respects to their elders past and present. I would like now to begin the webinar, and I'd like to begin by also thanking Alexandra Jones, who's not one of our speakers, but who has been instrumental in helping us put the webinar together, and it's greatly appreciated the effort that she made. In this webinar, we will do a couple of things. The first one is have a disclaimer declaration of conflicts of interest that you can read on the screen, that was on the screen a moment ago. The objectives of the seminar are to facilitate knowledge sharing and collaboration, to engage professionals from different fields, to provide new, innovative and applicable ideas, to enhance relationship building, and to develop community health systems, because when we are talking about front of pack labelling, we are talking about public health systems. We also want to create guidelines to combat unhealthy diets and NCDs. Do keep in mind that none of us see the front of pack labelling as the answer to any of our health problems. It is a small part of a much wider issue in terms of nutrition and diet. In today's webinar, we are going to start with Lorena Rodrigo-Oziak from Chile, who'll talk about food warning labels and regulation in Chile, followed by Mike Rayner in Britain, who'll talk about the traffic light system, Mary Lab from Canada, who'll talk about the mandatory FOPL policies, front of pack labelling policies there, Chantal Julia from France, who will talk about the Nutri-Score system, and Cleona Nimershi from New Zealand, who will provide the Australia-New Zealand Health Star system perspective, and then Rebecca Bousted from Kellogg's in Australia, who will talk about industry engagement. We'll follow that with the discussion, and for those who are attending the webinar, there is the opportunity to chat online, to put questions online. We will also run a poll in the process. And I do need to thank our sponsors, which includes the Australian Health and New Zealand Health Star Rating, Kellogg's, Sanitarium, and the University of Geneva. And I also draw your attention to the hashtags that we are for those who are tweeting. I think my preferred one is the front of pack labelling FOPL, but there's reasons why others might use other ones, and that's fine. The context here, of course, for us is the Sustainable Development Goals, because it's not just Sustainable Development Goal 3, as this is how it's presented by the World Health Organization, but look at no poverty, look at hunger. There are many Sustainable Development Goals that impact on health and that have an impact here. And also within the way we see public health, which is broadly defined in our Global Charter for the Public's Health, that takes protection, prevention and health promotion, and then has 4 enablers: good governance, accurate information. We say accurate information since Donald Trump, capacity building, and advocacy. And we always see these as being read together. And here, the Global Charter for the Public's Health has been used as part of the framing a call to action on the front of pack nutrition labels, and our speakers have agreed to the call to action, which will be circulated as part of this webinar and coming out of this webinar. And I mentioned those basics and then the enablers. So in terms of the front of pack labelling concepts that underpin different systems, there actually still no definitive agreement on what those systems should be. What we really need is a clear and simple and interpretive system that's made of symbols and colours. That's generally, I think, all are agreed on that. And what we're trying to do, of course, is make healthier choices the easier choices. And I think one of the most important things, and one of the things we're still working on, as Cleona will identify and others, that making systems that are nutrient-based but as consistent as possible with dietary guidelines can be quite challenging. And I suppose that means that we also understand that it doesn't matter what our system is, it's never going to be perfect. We're trying to get the best we possibly can. And many of us believe that they should be mandatory, and certainly those in public health. So for this webinar, though, I think we should be conscious that there's 20-odd countries with different systems. We are trying to see international coordination, and it's interesting that CODAX, the Food and Agricultural Organization, United Nations, are attempting to get some agreement on principles, but each government still seems at the moment to rely on different principles. There is work being done on this, and certainly a committee within CODAX chaired by Costa Rica and co-chaired by New Zealand is looking at it. But we also have to keep in mind that CODAX has a dual role. It's not only there to promote consumer health, but it's also there to promote fair trade practices as part of its role within the World Trade Organization. So sometimes we have concerns about disproportionate representation by food industry within CODAX. And it is interesting that in some of those countries, 5 countries who do have mandatory proposals, concerns have been raised already at the World Trade Organization. We hope that those concerns will be overridden and that health will take priority, but that is an issue for us. And it's also important for us to, in this webinar, to talk about and understand the role of industry, which is why, of course, we have invited Rebecca Bousted from Kellogg's to join us. And I think, finally, I'd like to say that it is a public health webinar organised by the World Federation of Public Health Associations. And for us, the priority of public health in all decision-making regarding improving diet has to remain as a priority. And I can't help myself because I am with the World Federation of Public Health Associations. I am going to advertise our Congress, so you can start planning for the World Congress in Rome in 2020.